Well, the so-called experts on chemicalising and confusing children in the false attempt to make a boy a girl and a girl a boy, the group's called WPATH, they made a stunning admission last week. So stunning that our New Zealand media ignored it. You'll soon know why, because it goes against the narrative around so-called gender affirmation for children. Let's check it out. So, as stated in a report by Daily Signal, the transgender movement has been notorious for demonising its opposition. Groups have suggested that disagreement with transgender ideology contributes to suicide, and social media companies have silenced critics for similar reasons. Now, the transgender movement's sainted authority on medical issues is effectively admitting that there is more than one position on the issue, and telling a court that preserving open debate on transgender healthcare is a public good. Oh, good to know. The radical activist group pushing the transing of children, WPATH, now says WPATH is on one side of the debate that provides guidelines on how best to provide transgender healthcare. Others, such as Dr. Hilary Cass, remember the Cass Review in the UK, falls on the other side of the debate and disagrees with how to or if one should provide transgender healthcare to adolescents. But here's the problem. Democrats, activist groups and medical associations have long cited WPATH, the World Professional Association for Transgender Health, has quoted their standards of care as the ultimate authority on a scientific consensus for sex-rejecting procedures. Well, so does the New Zealand Ministry of Health as well, which we'll see in a minute. But WPATH just made an admission in court that threatens to undermine that exalted authority. And WPATH and their affiliate in New Zealand is PATHA, Professional Association for Transgender Health, Aotearoa. And they're the driving force for transing kids in New Zealand also. In its case against WPATH, the Federal Trade Commission, this is in the US, presented core deceptive statements based on the 8th edition of the WPATH Standards of Care, claiming that these statements mislead consumers into self-harm. The association claims that those statements are non-actionable opinions about subjects on which there is medical and scientific uncertainty. Well, of course, these are claims also made by Sue Bagshaw and other activists in New Zealand wanting to persuade children and their parents that children can change their sex with chemicals and castrations. I'll come back to them shortly. WPATH even begrudgingly admits the validity of the Department of Health and Human Services 400-page peer-reviewed report, finding extremely weak evidence of any benefit for gender-affirming care for minors. WPATH wrote, the federal government has thus already alerted doctors and the public to what it views as problems with WPATH's speech. That is the exact remedy the First Amendment envisions, the free marketplace of ideas as the best means for discovering truth. Oh, they're referring to the Health and Human Services, this is in the US, 400-page peer-reviewed report that our media deliberately ignored also. But it's just about free speech now, rather than ramming down an ideology and cancelling anyone who disagrees with transing the children. Now, over the weekend, also, the Australian newspaper reported this significant development. Yes, we have to travel across the Tasman to find a media outlet honest enough to report this significant development. And it says this: medical professionals and parents are urgently calling on federal and state governments and health authorities in Australia to review the policies on gender medicine after the WPATH sensationally conceded its statement of care are merely opinions in an area of significant medical debate. Standards of care for Australian patients, including children, are currently based on guidelines generated by trans health lobby group, the Australian Professional Association for Transgender Health, which are clearly modelled on those of WPATH. So they've got their one, we've got PATHA in New Zealand's case. WPATH further described transgender healthcare as an area of significant medical debate, acknowledged there were parties on both sides of the debate, and stated WPATH is on one side of the debate. So they're not the experts. The concession has prompted the Australian branch of evidence-based health charity GenSpect to demand an urgent review of all medical pathways built on WPATH guidance, including puberty blockers, cross-sex hormones and surgery, as well as anger from parents, with one mother of a gender-distressed child writing to the health minister saying her child had been permanently altered within a healthcare environment shaped by this model of care. But that wasn't the only bombshell from last week that the New Zealand media didn't want to tell you about. According to this report in the Christian Post, it says this: the US Department of Health and Human Services released a report Thursday alleging that hospitals and doctors used incorrect medical billing codes to obtain insurance payments for puberty blockers, cross-sex hormones, irreversible sex change surgeries performed on minors. The 64-page report, titled Wolves in White Coats: How Doctors and Hospitals Pushed and Profited from the Fraud of Gender Medicine, reviewed nationwide insurance claims from 2015 to 2025, and it found that nearly 50 million was billed to public and private insurers for puberty-blocking drugs administered to patients aged 9 to 17, using a code endocrine disorder unspecified, a diagnosis code that doesn't reference gender dysphoria. And JD Vance, the vice president, wrote on X, "For years now, some hospitals and healthcare providers have been subjecting children to horrific experimental treatment in service of radical gender ideologies. Today, thanks to the Wolves in White Coats report by the HHS, we know why. Profit." Yep, it's all about the money. Is that the case in New Zealand? Or is our government funding this stuff? But remember that it was the Biden administration that was pushing a lot of this. Do you remember Rachel Levine, the biological male who thought he was a woman? Well, so did Biden, of course, and was the United States Assistant Secretary for Health. And this is what he was saying just a few years ago.
What do you say to folks who think that they're being reasonable by saying, why can't children just wait till they're 18?
Adolescence is hard and puberty is hard. What if you're going through the wrong puberty? What if you inside feel that you are female, but now you're going through a male puberty?
The argument is, well, they're too young to know.
I want to make it clear that for prepubertal children, there are no medical procedures done. The standard of care allows them to explore that with therapy. Well, gender-affirming care is medical care. Gender-affirming care is mental health care. Gender-affirming care is literally suicide prevention care.
Yeah, well, it's not. And WPATH, and by implication PATHA, here in New Zealand, have admitted their position is debatable. Debatable. While we pump children with puberty blockers, wrong sex hormones, and lead them to mastectomies and removal of healthy body parts in the false belief that a child can change their sex. But the New Zealand media and the Ministry of Health have told us that WPATH and PATHA are the gold standard. Trust them. They know the science. Except they don't. So where does New Zealand fit into all of this? Well, New Zealand extremists have their paw print all over WPATH and their so-called standards. But before we do that, let me remind you that at the end of 2022, WPATH released its so-called Standards of Care 8th edition. And one noticeably different aspect from previous editions was that the explicit stated minimal age recommendations for minors to get puberty blockers, cross-sex hormones and surgeries had been removed. The new guidance also suggested that if parents did not affirm their child's newly chosen identity, the state may be enabled to intervene in order to assist with the child's transition. And look, here's the key bit. WPATH has significant influence in New Zealand. Transgender research based on Counting Ourselves survey and policy comes out of the University of Waikato's Trans Health Research Lab. And unfortunately, the unit's driven by activists and an agenda rather than science and independent research. In fact, it's now in conflict with the science. Now, we've written in detail on the weaknesses and flaws of the Counting Ourselves survey that the unit does. But let me just show you this document. This is the WPATH guidelines for gender affirming care. And this is in New Zealand, and it comes out of the group called, wait for it, PATHA, which, is the New Zealand equivalent or affiliate to WPATH. And in their guidelines, they specifically say this: WPATH is the international body responsible for producing standards of care. This guideline is not intended to replace the WPATH standards of care, but to present additional guidance for the provision of gender-affirming healthcare in Aotearoa, New Zealand. Puberty blockers, cross-sex hormones. WPATH is basically the go-to for guidelines around treatment of gender-confused children in New Zealand. Here's an article from 2022 when the alarm was being sounded about the exploding number of children being prescribed puberty blockers. And it says this: the number of children prescribed puberty blockers because they do not identify with their assigned gender has increased exponentially in the last decade, according to Pharmac data. The Ministry of Health has recently updated its information on puberty blockers on its website to remove the words safe and reversible, but still endorses the Professional Association for Transgender Health Aotearoa PATHA guidelines, which states they are considered to be fully reversible. Yes, the Ministry of Health has been backing WPATH and PATHA. Now, here's their response to an OIA back in 2020 with reference to reliance on WPATH guidelines. Readiness assessments are as per the World Professional Association for Transgender Health Standards of Care version. Or more recently, in 2024, their website showed this: for referral acceptance to be considered, patients need to meet the eligibility criteria set out in the Standards of Care for the Health of Transsexual, Transgender and Gender Non-Conforming People, published by the World Professional Association for Transgender Health, WPATH version 7. So WPATH is the international body. PATHA is New Zealand's version, which is basically a lapdog for WPATH, and are influencing the blind and flawed gender affirmation model being rammed down in New Zealand. Now, fortunately, the current coalition government, and especially the Minister of Health, Simeon Brown, and also lobbying from Winston Peters, New Zealand First Leader, has started to turn this around. But I know you're asking, who is PATHA? Well, it was formed in 2018. It's a group of trans activists, some of whom have found their way into the medical professional setting. It's only a handful, but here is some of the committee, the executive committee, and it's interesting. We could find this information previously, but it's disappeared from the website now. It seems the blowtorch of reality has sent them into hiding. But look, here they are. Dr. Jamie Veal, she, her, a transgender woman, so a biological man. He's an associate editor of the International Journal of Transgenderism, a member of the global board of directors of the, wait for it, World Profession Association for Transgender Health, WPATH. Oh, and he's one of the authors of the latest revision of the WPATH Standards of Care. So a New Zealand activist is on the global board of directors for WPATH. Dr. Rachel Johnson, she, her, a general paediatrician and adolescent health physician working at Counties Manukau DHB, well, it's now all part of the one big conglomerate, Centre for Youth Health. She's been involved in trans healthcare for over 10 years and in that time has been a member of WPATH. Oh, and she was actually featured on an atrociously biased piece of trans advocacy by the Sunday program a couple of years ago, pushing the normality of puberty blockers, just based on what the child wants.
I think if young people who need blockers can't access them, that can potentially be very harmful for trans youth.
Yeah, okay. And there's also Jennifer Shields, a trans advocate, non-binary trans woman, Dion Reid, who's a trans man and registered nurse, Phoebe Horton-Andrews, a transgender activist from Rainbow Youth, who's studying towards was an accounting degree. And then there's this advocacy committee. Jack Byrne, he, him, a trans man, so a biological woman, who oversees the flawed Counting Ourselves research. Tane Polkinghorn, he, him, who is the New Zealand Human Rights Commission's advisor on sexual orientation, gender identity and expression, and sex characteristics. Yes, now you know why the Human Rights Commission is so keen to chemicalise and confuse children. And there's Moira Clooney, they, them. Yep, all radical activists for transing your children. And the media have been their greatest cheerleaders. Back in April 2024, five independent, so-called, mainstream media outlets, Radio NZ, News Hub at the time, One News, New Zealand Herald, News Talk ZB, who all apparently add to democracy, reprinted the same exact story. Criticism of puberty blockers, misguided, trans girl's mother says. All 5 mainstream media outlets. Exactly the same article and the same narrative. And it said this: Health New Zealand Te Whatu Ora has commissioned the Professional Association for Transgender Healthcare Aotearoa, PATHA, related to WPATH, to update its guidelines for gender-affirming care for healthcare professionals, including the use of puberty blockers. But here's what one of the lead New Zealand doctors in this radical experiment says. It's back to our doctor that I just showed you. This clip is from Paddy Gower's Paddy Gower Has Issues, when they talked about the issues of puberty blockers. And it was after the Ministry of Health had quietly removed the statement about puberty blockers being safe and reversible. They did it quietly, but we were watching and we called them out on it. But have a watch and note that the doctor, yes, is a member of none other than PATHA, associated with WPATH.
Blocker use has ramped up in the past 10 years. In 2010, there were 137 young people using them, and it's gone up every year since. Last year, 771 people were on them. Before September last year, the Ministry of Health had said this about puberty blockers on its website. Puberty blockers are a safe and fully reversible medicine that allows people time to fully explore gender health options. But in September last year, they quietly changed it, taking out the part that says safe and fully reversible. It's a big debate, so I went to find out what puberty blockers are all about.
The expert, off to the expert.
Puberty blockers are a medication that
PATHA member.
are used to just pause puberty. They can't turn it backwards, so they can't reverse changes that have already happened, but absolutely they can just pause things. So this, if you imagine if physical changes that are causing distress are occurring, by stopping those can be incredibly beneficial, on a physical level and on a psychological level. But if you were to stop those puberty blockers, puberty would just kick in again.
Auckland paediatrician Dr. Rachel Johnson is currently seeing a variety of patients, from young children to people in their 20s.
Over 10 years of following young people who are on blockers, well, I do think that accessing puberty blockers in the context of the way that young people can in New Zealand is really appropriate. They're not some universal treatment for every trans youth. A youth, that's always a really carefully considered decision whether, the benefits outweigh any potential risks.
Are they safe and reversible?
No.
I would absolutely say in the years of experience of using blockers and based on the worldwide evidence that they are a safe and reversible medication.
Yeah, just refuse to acknowledge the science, deepen the ideology. They'll have a lot to answer. PATHA were part of the group wanting to keep the radical RSE curriculum, relationships and sexuality education. Yeah, according to this report in One News, an open letter is calling on the government to keep the current relationships and sexuality education guidelines in schools and kura, despite coalition promises to do otherwise, because of the demand of parents, of course. 26 mental health and rainbow organisations have written an open letter to the government this week, asking it to retain the current RSE guidelines. The letter said the guidelines were beneficial for schools and students. Who were the organisations, you ask? Well, they're all radical organisations, but you'll see top right there, of course, the Professional Association for Transgender Health Aotearoa, PATHA, a part of this radical list of signatories. In fact, this story really concerned me. This is a report from the centrist news service. One of the many news services to pop up as trust in the mainstream media plummets. And this is what their report said. Oranga Tamariki, OT, has just signalled it's ready to knock on family doors if they refuse to let their children change gender. While OT says that parental resistance to a young person's transitioning would not normally be a concern in and of itself in the absence of any risk factors, they elaborate that there may be times where a situation involving a rangatahi young person who is actively considering or is in the process of transitioning is facing resistance from whānau, and that may be having an impact on their safety and well-being. So, what it's saying is that the resistance to protect a child by a loving parent from confusion, chemicalisation and castration is a problem, apparently. Now, I went to the practice centre of Oranga Tamariki and there was this page, affirming gender diverse tamariki and rangatahi. And you'll see there a link to Rainbow Youth and, of course, a link to the guidelines for gender-affirming healthcare for gender-diverse tamariki and in New Zealand and adults in Aotearoa, New Zealand. Of course, none other than the WPATH, the Radical International Group, which has now been discredited completely, and PATHA, and the Waikato Trans Unit, which is a radical group of activists, as previously discussed, with their deeply flawed guidelines. In fact, on their latest resource, on their website that I visited over the weekend, they continue to list PATHA. Now, remember, here in New Zealand at the end of last year, just before Christmas, a decision by Justice Wilkinson Smith in the Wellington High Court was to grant an injunction on the government's ban on puberty blockers, the proper ban on puberty blockers. But no, that was held up until a judicial review was to take place, which did about a month ago. We're waiting on the decision, but the decision by the judge repeated all the discredited talking points of the Professional Association for Transgender Health, PATHA, aligned with WPATH, and the judge based her decision on statements which are in direct conflict with the United Kingdom's CAS review and even the Ministry of Health's evidence brief. But here's the New Zealand Herald campaigning for PATHA back just in March, reporting on the judicial review of puberty blockers. And they say PATHA is an interdisciplinary professional organisation that works to promote the health, well-being and rights of transgender people. And also in the New Zealand Herald in July. And this one said, the government's attempt to ban puberty blockers for gender-diverse young people would be both unethical and harmful, a group of concerned doctors say. Their views have been published in a paper, A Clinical Ethics Approach to the Use of Puberty Blockers and Gender Incongruence in today's New Zealand Medical Journal. It comes as a group of health professionals working in this area. Wait for it. PATHA, the Professional Association for Transgender Health at Aotearoa, has taken a judicial review to challenge the Ministry of Health's decision to ban the new prescriptions for puberty blockers in November last year. Notice how the Herald calls them a group of health professionals. No, they're not. They're a bunch of gender activists. The authors of the paper are Associate Professor Cindy Towns, Dr. Rona Carroll, Dr. Jemima Bullock, Professor Paul Hoffman, Dr. Richard Carroll, and Dr. Andrew Linton. Some work directly with gender diverse young people, and Rona Carroll is a member of the PATHA Executive Committee. So they're all campaigners for chemicalisation, castration of confused young people and think that a boy can be a girl and a girl can be a boy. Associate Professor, one of the authors, Cindy Towns, said puberty blockers are and should continue to be prescribed only by experienced doctors working within multidisciplinary teams. The medications are safe and reversible and have been used since the 1980s for a variety of conditions, not just gender incongruence. Well, sorry, Cindy, that type of argument belongs back in the early 2020s. It's been well and truly debunked now, thankfully. Oh, And by the way, just to really make your day, Tourism New Zealand is helping sponsor and bring the 2028 WPATH conference to New Zealand. Yeah, unbelievable. Hopefully they'll have been sued into oblivion before that. So just a reminder, the so-called experts have conceded its standards of care relating to flawed attempts to change the sex of children are merely opinions. We already knew that. It's time the government acted swiftly to instruct the Ministry of Health to take what PATHA says as merely an opinion of radical activists and to ignore them. They have no credibility. The game is up. It's time to protect children from gender ideology, once and for all.